Hi, my name is Alyssa and I'm the main head and I'm from group 25. So today I will be talking about the signs and symptoms of gastrointestinal disorders. Well, occasionally we all experience digestive upset. So how are you supposed to know the difference between when your gastrointestinal symptoms are a temporary inconvenience and when they are indicative as a digestive disorder? So when they're persistent or severe, you can actually detect them by knowing the few symptoms that I will be mentioning in a bit. So gastrointestinal symptoms can vary in intensity from very mild to serious. If you're experiencing the symptoms below over and over again, or if they cause you significant discomfort, your body will be trying to tell you that you have a digestive condition. For example, I'm going to give you the first example of the symptoms and signs of gastrointestinal disorder. Bloating could be a sign of several gastrointestinal disorders like irritable bowel syndrome or food intolerance such as celiac disease. So the next symptom will be constipation. So the National Institute of Health (NIH) defines constipation as having less than 3 bowel movements a week or passing hard dry stool, and several digestive diseases count constipation as a warning sign like IBS with constipation. And if this constipation is a typical problem in your life, you could be suffering from chronic constipation, which is a recognized gastrointestinal disorder. And the next symptom would be diarrhea. If you have chronic diarrhea lasting longer than a day or two, it could signify a digestive disorder, such as lactose intolerance or inflammatory bowel disease, which is IBD. And the next symptom and sign of gastrointestinal disorder would be heartburn. So if you experience heartburn 2 or more times a week, you might have gastroesophageal reflux disease, which is called as GERD. If it left untreated over time, the acid from your stomach can damage your esophagus and lead to complications. And the next symptom would be nausea and vomiting. So nausea is often a sign of extreme pain, and it could be the result of anything from an allergy to cancer. And nausea or vomiting could also indicate an infection in your gastrointestinal tract or gallbladder, for example, like appendicitis, diverticulitis, also could be in pancreatitis, and also irritable bowel syndrome or intestinal blockage. So the last symptom of gastrointestinal disorder is abdominal pain. Most digestive diseases include abdominal pain. So if you're experiencing persistent abdominal pain, then you should see a physician right away, because this could be a signal of an ulcer, diverticulitis, or irritable bowel syndrome, which is the IBS. And last but not least, before I finish the video, I would like to say if you are experiencing any of these worrisome digestive symptoms, do not hesitate to contact any endoscopy center for an evaluation. Because if you're not sure if your gastrointestinal symptom is serious enough to see a gastroenterologist, remember that any symptom you would define as persistent or severe deserves a diagnosis. So that's all from me. Thank you so much for your attention.